Good Saturday and happy weekend, Malaysia. Welcome to the Lim Ren En Life Success Stories series. This show is dedicated to improve the lives of people who want a positive change. Now, I have the privilege to know many successful people throughout my career, and I have witnessed many amazing stories of successful business people who came from humble beginnings and made it in life. Now, there is a formula for success, and you too can be a successful person. I am your host, Lim Ren En, past country chair for MDRT Malaysia, and an insurance agency manager for AIA Berhad. So let's get on with our show today. And today we have the honor and the privilege to have and invited one of the most talented and upcoming aesthetic physicians in KL, Dr. Su Senn. Welcome to the show. Now, Dr. Su Senn was destined to be a doctor, moreover, an aesthetic physician. So after her houseman's years, she knows her interest in skin and beauty treatment and has spent many years in studies outside her working hours doing research and courses to be a better aesthetic physician. Now, so with Liv Clinic, working together with a team of dermatologists, she vowed to bring back the younger you. Using natural and medically proven treatment, she treats each client and each patient with care and only prescribe safe skin products for aftercare maintenance. So Dr. Su Senn will share with us today her insights on slowing skin aging and also on the treatment available now to bring back the younger you. So she will also share the day-to-day skincare and tell you all the taboos and the mistakes people make in skincare. So let's welcome Dr. Su Senn to the show today. Welcome Dr. Su Senn to Lim Ren En Live. Yay!
Hello everyone.
Hi
Hi
Dr.
all the
Su Senn,
audience
how are
and
you? How are you doing?
hi, I'm good. How are you? Pirates of the
I'm
Caribbean.
as you can see to all my audience outside, why am I wearing an eye patch? You know, my sister was telling me, why are you borrowing a Madonna bra? If you're my age, you understand what am I talking about, right? But I mean,
I'm younger, but I
yeah, you're
understand.
younger, so you don't know. So what I'm telling you is that I just had a retina detachment surgery. It is a medical emergency. It happens right the morning before I'm supposed to do a recording with you last Wednesday, right?
Yep.
I called you at 8 o'clock. I told you, you know what? I think I need to see a doctor. But at 9 o'clock, I called you and said, I can't do the recording anymore. I need to go to surgery. So
Yeah.
that was it. That's why I'm using an eye patch. I'm not blind, actually. I'm still okay. But it is very uncomfortable to look at the camera and also all my studio lights shining on me. That's why I'm wearing an eye patch. So that's enough about me. Now let's talk about you, Dr. Su Senn.
Yeah.
So tell us a little bit of your background and where are you from and which school you came and you went to.
All right. I'm Dr. Susan from Liv Clinic. Yeah, I'm from Penang actually. Yeah, and I study in the Russian National Research Medical University in Moscow in Russia. Yeah.
So you meant that you went to Russia to study medicine
Yes.
and you actually learned a whole new language, study medicine.
Yeah.
Wow. So you speak fluent Russian actually?
Not fluent, but able for me to maintain my daily life.
Oh, right.
Yeah,
Fantastic.
like
So
buying vegetable from the auntie in the market.
now tell us a little bit of your life in Russia. How was it? Was it difficult? I mean, is it tough?
Well, in Russia, I think I spent about 7 years there. Yeah, it's all about study, exam, all the big exam and small exam. But we all had fun there.
All
Yeah,
right.
the most challenging part I think would be the weather. The
Cold.
first year ever I went to Moscow, we experienced the most crucial winter ever in the 100 years. Yeah, it reaches negative 30, 32 in the morning and afternoon, and you have to walk through all the snowstorm to reach your uni.
Oh my God. You know, and we
Yeah.
are complaining our aircon is 16 degrees and too cold, right?
Yeah.
Just tell us. And you had an amazing journey going through
Mm.
Moscow 7 years, coming back, doing your houseman all over again, and earn your stride as a doctor. So why medicine of all careers? Why do you want to do medicine?
Well, a lot of people ask me these questions. Basically, growing up in an era where all this IT is developing, you're seeing all the robots, machines, and replacing human work. So when I was a kid, I was thinking, am I able to survive in my adulthood in terms of finding a job? So I was thinking, what kind of job that is irreplaceable by all the machines and all the IT? That would be doctors. You won't trust a robot to operate on you, right? And you can't trust a robot to diagnose your diseases, right?
I can agree, but nowadays urologists are using a lot of robots, right? They are doing robotic
Yeah, still you
surgery.
need a urologist there to operate the robots.
Yeah, true. I can agree. I can totally understand.
Yeah,
Where are you coming
that's,
from there? So,
that's how I ended up in medical field.
okay,
Yeah.
of all subspecialty, you chose one of the most interesting, which is aesthetic. And aesthetic is very linked to beauty, right? It is
Yep.
basically making another person looks prettier, more beautiful, younger. Why aesthetic? Why not other things? Why aesthetic?
Well, being a ladies, I know
I may.
and that yeah, it's out of interest actually. I was in ENT before I ventured in aesthetic medicine. So from ENT side, I've seen few patients with the complications of aesthetic. Yeah, that's how it drew my interest. Yeah, and how during housemanship time, I already start like attending all the aesthetic courses that is available or whatever chance that I have. And that's how I developed more interest in aesthetic field. So after I complete my compulsory services from the government hospital, I venture into aesthetic.
So you are telling us, even in your houseman year, you were actually
Mhm.
attending aesthetic classes, and even during
Uh,
your postgrad years, you are attending already.
yeah, it's out of interest and it's more like a conference. Yeah, because what we are learning in aesthetic medical field is so different from what we learn from our usual medical school.
So aesthetic
So,
is so the usual
mm,
medical school doesn't teach you aesthetic basically lah. Basically,
yeah,
the
it
usual medical
doesn't.
schools teach you how to cure a disease.
Yes.
Mm.
So I would say for medical field, it's more like treating. Now we are venturing more into anti-aging and aesthetic, which is preventive medicine.
Mm. Yeah, so you're actually on the forefront of it, of medicine, basically going into preventive medicine and telling people to look younger and age later.
Age gracefully and age, I would say, age more prettily.
Age grateful. I totally agree with you. I totally agree
Mm.
with you. So, Dr. Susan, you have spent what, 12, 13 years very hard to reach where you are now. So tell us a bit of a process there. How hard, what kind of hard work you have put in?
Well, basically, attending whatever conference that is available for me to attend during my houseman time, which means I have to fly all the way from Sabah back to KL just for the course and fly back to Sabah and continue my work. Yeah, and attaching to few clinics, learning from the senior. Yeah, and keep on asking the questions and hands-on and experiencing out before I really do it on my patients. That is very important. Yeah.
So it is all hard work, right? It is no easy work, no shortcut to whatever you are doing.
There will never be shortcut.
Yeah, I
There will
totally
never be
understand.
shortcut for all successful story, I would say.
So now you have a new clinic. Tell us about it. So I'm going to the presentation. Tell us about your clinic. What kind of service do you provide? I'll go into presentations for you. So this is Liv Clinic. This is your clinic that you have started with a group of partners. Tell us a bit about this. Where is it? Where can we find you?
So basically, Liv Clinic is located in Bukit Jalil City. Going to be nearby. Soon gonna open Pavilion 2.
Wow.
Yeah.
Pavilion
Yes.
2.
I'm waiting for it.
You guys also know very, very well where to find a nice place to start, right? Right.
Yes.
So this is how the clinic looks like.
Yep.
Yeah.
So this is our reception. Yeah.
Yeah. I'm actually a client also. I've been there quite a few times. So let's
Yes.
tell us what actually do you do? What kind of treatment do you do for your patient? Let me just go through. So this guy looks very familiar.
Except without the eye protection.
That is actually me. That is actually me. So I do visit Liv Clinic and do, my facial. To be fair, you can see it's getting better, right? And getting better.
Yes.
This one no lah. This one because I scratch it, actually not your fault. Getting better. I went and visit Liv Clinic. Why? Because I wanted my skin to look very good in front of the camera. So you still remember that conversation I had with you, right?
Yes.
I just want to look good in front of the camera. So she did this for
Still
me.
got some process ongoing. You still
Yes.
do something. Yeah.
Still on process.
But
So
yeah,
tell
we
us
take it
about
slow.
this. What is the progress we're looking at?
Okay, so basically, Mr. Lim came to me, complained about some marks, some pigmentations on the face, like full face pigmentations, and there is actually lentigen and some of the mole, and also what we call seborrheic keratosis. So what we do here is we use some laser treatments and to reduce the pigmentations.
So it is actually laser treatment
Yes, we are doing some laser treatments for you. So it will require some time. You can see in the middle photo, there are some recurrent periods, what we call the downtime.
So this is the recovering period.
Yes, yes. So once after recurrent period, you can see it's on the process of healing. So it will take some time for the marks to go away as well.
Actually, it's pretty significant, right? You can see that all these 3 dots are all gone. All these are all gone, compared to this. Right, it is work in progress, I have to say. It's not done yet, Still got a lot more work to do, all right? So if you ask me, actually Dr. Susan is my first aesthetic doctor, but I'm happy. I'm happy.
I'm glad that you like it.
My wife has gone to a few, but she still feels that Liv Clinic actually is one of the better ones. One of the better ones that she actually visited. So I don't go alone, I go with my wife.
Yeah.
My wife is
Lovely
also doing
couple.
some treatment. Yeah. So Acne and Scar program. So tell us a bit about this. What is this Acne and Scar program?
So usually in Liv Clinic, a lot of acne patients. Yeah. So for long run, acne is not treated properly, you will leave out a scar. So a lot of patients came to us, it's not only acne also with a scarring problem or it's just for a scarring problem. So basically acne and scar, usually we will customize a program based on the person's severity case and also the skin condition, of course with the budget as well. So we will tailor a program for the dedicated patient. Yeah.
Okay.
Because acne and scar don't really treat in one session. Yeah, so we call it a program.
All right. So tell us about this young man.
So basically, this young man is early of 20. He have a suddenly breakout of acne with unknown reason, just sudden, quite bad because all this while he's having a very smooth skin. Yeah, so he came to me one day and asked for help. So Basically, we'll take the full history. Okay, he actually started some treatment and which contain a very high daily product on it. So this one of the cause that caused the acne formation. So
Ah.
what we do is arrange him into have one sessions of our chemical peel facial. Some extractions is done, and also we started on some medication for him. So and consult on his proper skincare routine. So after one treatment, this is the after photo.
Oh, one treatment, you actually can clear it
Yes.
out.
Yes, because it's very compliant to our regime. From medication, skincare, and also our treatment facial.
Okay, all right.
Yeah.
So this is the same guy?
No, this is a different guy. His case is milder. He's suffering for acne problem on and off for quite some time. He never had treatment before. So he also came to us. So what we advise is we started on some oral antibiotics, so some medications, some skincare, and also one of our medical grade facial.
Okay. So this guy, tell us about this. This is what we Chinese say 豆皮脸啊？
都皮脸，月亮脸。
月亮脸 right? And you can
Yes.
actually treat this also.
Yes. So basically, this is what we call acne scarring. So acne scarring usually it depends on severity and scarring type. For him, I use a combination treatment of substitutions and also injections of some growth factor. But this is after like 4-5 sessions. Yeah, this is the result they have.
So guys, if you have, moon scale kind of face, I think Dr. Susan is somebody you should go and see. So she even can treat this. This is amazing. This is good. So we've got a lot of people actually with this problem.
Yes, I think I've been facing a lot of patients with this kind of problem. They come in their late 30s, mid 30s, and then say, I actually want to treat my acne scar problem. Yeah, because they have suffering of acne problem since their teens. This is what a not treated acne will leave on for you.
Yep, totally agree.
Yeah.
So this is scarring on the head.
Yes, actually, this is my friend. She met a very terrible accident about 1 year ago. Yeah, so she had a few sutures on the forehead. So I did some treatment for her as well. Yeah, just some pico laser and also resurfacing and also some PRP injections. This is after 2 sessions. Yeah.
And you can see you can see the real difference, right?
Yes, I cannot totally reverse it because I'm not doing a plastic surgery, but I can improve the situation for her.
That is good enough, I think. I think she's very grateful that you have done this for her.
Yeah.
And what is skin maintenance program?
Basically, skin maintenance program is like our monthly facial. But the facial we provide in Liv Clinic is different. We only use medical grade products, and we use medical grade machine as well to help you to just exfoliate your dead skin, just like how you do your monthly polishing of the car.
So you only use medically approved products,
Yes. All the products that we use on our facial are all medical grade.
So
it will be different from the other facial like the salon type.
So there's no this nonsense of using unwarranted or basically just medically grade approved by KKM kind of product that you only use. Now this is very important, right?
Yes. This brand is actually all registered and it's been widely used by all the dermatologists in the world. Yeah, especially its clinical CEO, all these medical grade products.
So to all the audience outside, I think safety on aesthetic medicine is very important. You know, okay, since we are here, let's talk about safety. There's this lady, a model who died recently for liposuction in an unauthorized clinic. As a doctor, what could you say about that incident?
Yes, indeed, that is a very, very sad case. And to be frank, this is not the first case. There's a lot of complicated cases come over to me or my colleagues regarding filler injections or nose thread or some procedure that done in so-called aesthetic salon or medispa, which is not run by a doctor. So whenever you visit a place where you want to do procedure, you must make sure it's a doctor, it's a licensed doctor, that's most importantly. Okay, secondly, you must be very comfortable and confident with the doctor after go through a consultation.
Right.
And also when you are ready.
I think that is,
to do the procedure.
I think that is so important, right? To go to a proper doctor to actually do this procedure. So to all our audience and friends outside, please do not save that 1,000-2,000 ringgit and go to a salon or somebody who claim they can do it. You must go and see a proper medical doctor, right? So thank you so much for addressing that. I want people to actually know that as well, right? So let's go back to this. So you're saying, so tell us a bit more about this, doctor. This is skin management.
Yes, more like skin maintenance for outer cleanliness or exfoliation, I would say. So basically, our skin there's a turnover rate. So with the use of medical grade facials or some skin maintenance program, we can help you to exfoliate the dead skin, rejuvenation, and maintain the cleanliness, especially all the blackheads and whiteheads. And people will complain about all this impurity, congestion. So what we can do is we can help you to clean your face like once a month. So this is instant immediate after photo of one of our facial treatments.
Wow, look at that face. So brilliant, so vibrant.
It's an instant white brightening, I would say.
So I can see your skin also very, very good.
Of course.
So hair growth program. I have a friend who wanted to come and see you, Mr. Ng. I don't know whether he came or not for this.
I don't think so.
let me ask him to come this Sunday to come and see you on this. So tell us about your hair growth program. How can you actually help people?
So usually hair loss is facing by a lot of people like men and women, not just for men. Okay, so for what we will do is usually when you come in, we will get a plentiful history of your hair loss started. And we will have a scalp treatment and hair analysis. Then we will find what is the actual cause that causing your hair loss problem. And then we will schedule and tailor a program that is dedicated for you. Usually it's a combination treatment, and hair loss is not going to settle with just one treatment, to be frank. So what we do is we will combine a combination of medications, hairspray, some scalp treatment if it's needed, some injection like PRP or some growth factor. And also we do have this FDA approved pterodon helm, which is a clinically studied paper, to improve hair growth.
Basically, it's a whole program. Basically, it's just a whole program of hair treatment from understanding your history, planning a program, and executing it properly, medically. Fantastic. It's not that why the Chinese YN kind of hair treatment, the YN.
Okay, we try not to mention name, but
the YN kind of hair treatment, right? I know. My friends spend quite a lot of money there and get nothing. Pixie is still losing his head. You know?
You should come and see me.
Yep, I know. He should come and see you.
Yes.
So now, skin remodeling. What is skin remodeling actually?
So basically, skin remodeling program is something to make your skin much more, useful, more elasticity. Useful, yes. More elasticity, more firmer, and maybe more fairer. Basically, just make your skin younger, going back to your age.
So let's see some of this. This is basically making you younger, right? This is where
In terms of improving the skin texture.
this is where your expertise comes, making you younger. So this lady went through this whole program with you,
Actually, she is halfway through the program.
and you can see so much of a difference already.
Yes.
Wow. Let's go on. This lady, wow. This is not lighting problem, right?
No.
This is real, huh?
This is real. Maybe lighting play a little bit role, but lighting cannot make your skin firmer.
Yeah, it's so much firmer, right? You can see.
Yes.
Right.
So basically, this lady just went through a few
This lady,
sessions of PRP with us.
ERP, huh?
Yes, using your own blood. Yeah.
Ah, using your own blood. If you want to know
Yeah.
more, you have to visit Dr. Susan and know about this. So what is this?
Sure. These ladies are suffering some acne issue for quite some time, and it was advised to go for facial once a month, but it shows no improvement. So he came to me, I explained the whole situation and execute some procedure for her. So her skin texture improved. You can see that it's less inflammation, less mark as well, and the skin is much more healthy looking.
Fantastic. So Scalp and Harmonizing.
So basically, Scalp and Harmonizing program is make your appearance more attractive. So a lot of Asian, I found out they are not satisfying with their nose bridge height. So they will come over to me and consult for some nose procedure.
Nose
And also,
procedure.
yes, and sagginess. So what we can do is we will see the total of features and advise accordingly, and depends on what the client wants to achieve. So we can design a program for her as well.
So let me get this straight. This is not plastic surgery, right?
No. I'm not qualified to do plastic surgery.
This is not plastic surgery. This is just aesthetic with medicine and with a bit of help to make the face a bit firmer or looks a bit better. So tell us about this. This is a V face treatment. What is this?
Basically, this client of mine are having some double chin issue.
Wow.
Yes, but she haven't ready to get on for a jaw augmentation. So what I can suggest her is we sort of like reduce the double chin size first. So whenever she's ready for the next step, then we do the augmentations for the jawline.
You mean I can also do a double chin treatment?
Yours one will need some work.
I need to lose another 30 kilos to start with my double chin treatment. Okay. But I want to ask you about the next one. This is V face treatment. This is also double chin. Now this is better, is it? This is also double chin, is it?
Not really. This one is more like we do some augmentation over the chin area. So after augmentation, you can feel the chin area is much more pointy. At the same time, when we stretch over the space, over the chin area, the double chin will look more flatter.
Yeah, this is before, this is after. This is much more flatter. You can see this chin is so much sharper than this one.
Yeah, even you can see the side profile. The chin actually is much more protruded comparing before. that's how the science came in. We stretch a bit of the space there, so the loose skin tend to stretch a bit, and the double chin will become flatter.
No surgery at all.
No, this is just by injections.
Fantastic. So I think this is very different. You see, this is a lot of
You have to
different.
see the chin height from a side profile. Yeah.
This and this is so much different.
Yes.
This is
So it really depends on individual. Different people will have different indication, I would say. Not everyone V-face is just Botox. Not everyone V-face is just injections. Sometimes you will need a combination. Sometimes you will need some to melt the double chin. So that's why when you come over, we will assess you properly.
all right.
I would advise people to go and consult your doctor before you perform some procedure. You might doing something that is not suitable for you. Yeah.
All right. So this double chin thing is. Oh, this is interesting. I've got a few overweight friends that can come and see you. They should lose weight
Sure,
first, or
can.
should they lose weight first, or they should come and see you first?
They can come and consult me, see what I can do while they are losing weight.
Okay, done.
Yes.
Now, this one,
Yeah.
this is
This one
firming
is
the face,
more-
right?
Yeah, more for overall facial harmonizations because she has a few issues to address. First of all, is the sagginess,
Yes.
and she needs some under eye treatment as well. So we do a full face augmentation for her. I mean, I would say harmonization, make her facial look more attractive or less saggy, less sadness.
Fantastic. She looks much better.
Yeah.
This is also the chin and the
No, this is
jaw.
the nose.
nose.
Yeah.
Sorry.
Yes, you can
Aiyo.
see she was actually one of my clients that have a history visiting some other place and has a nose thread done. Okay,
Basically,
so
she
she came
put in something in the nose to make it more straighter, right?
look more higher and straight, higher I guess. But she have a bit of crooked nose. You can see the nose ridge is a bit crooked from the top one.
Yes.
So after I did some augmentations, I tried to make her nose more straighter as well.
Yeah, this
Yeah.
is straightened already.
Yeah, much more straighter and much more higher.
This is by injection only.
This is by just nose track.
Nose track. Tell us what is nose track.
Basically, we will insert a surgical thread, what we call PDO thread or BCL threads, into the nose and stimulation collagen formations. So
it is
it
actually
will
a
give
string.
a thread.
Sorry, it is actually it is not a surgical thread, right? It's not a string, right? It's
It's a surgical thread.
xian.
Yes, it's almost same as a surgical thread. That's what we call BDL. Because a lot of the agents actually they are not happy with their nasal bridge height, so they can search for some aesthetic procedures such as fillers or also nose thread to make your nose higher or pointier, okay, without going through a surgery, or when you are not ready for surgery yet.
Interesting. You guys have gone so far already.
Not
No.
really.
Actually, I thought everybody has to do a nose job to get it right, but you don't have to do a surgery anymore. Fantastic.
It actually depends on cases as well. Yeah, but what we can do is just the outer appearance to look more straight. But if you have a deviated nasal septum that is occluding your breathing passage, I would advise still you go and find a proper ENT rhinoplasty surgeon to have the nose corrected. Yeah.
Yeah, true. So tell us about this. This one also, wow, all the scarring all gone already, all this.
This is doing nose.
This is doing nose ah. So on the side also you're doing this also lah.
No, she's put foundation.
Oh, okay. Sorry. I thought no need to cut. I think it's quite fun. So it's actually a nose job. Okay, sorry, it's a
Yeah.
nose job, guys. I'm not a doctor, that's why. It's a nose job. You can see the difference. Yeah.
Yes. So she had a very flattened nasal bridge, I would say. So we just make her nose bridge a bit more higher without going through underneath.
You just put a thread.
Yes.
How
And
long does
usually the
it?
recovery is quite fast.
How long does it take, sir?
For a simple nose thread procedure, most probably about 20-30 minutes.
Instant result.
Yes.
Wow.
Yes. But there will be a little bit of downtime because of the swelling. But it will take about 4-5 days, then it will be okay.
Oh, fantastic. No surgery, just put a thread. Okay.
Yes.
So this is interesting. Tell us a bit more about this. Just let me just do this. So this is your friend, one of your good friend, our good friend.
One of your good friend as well.
One of my good friend,
Yeah.
So yeah. So let me just.
So basically, your good friend.
Yeah.
Yeah, has.
So tell us
So
about
he's
this.
been suffering for acne scarring for quite some time.
Yeah.
So I'm doing combination method for him. So this is what we call subcisions. Basically, we are tunneling through and cutting out the fibrotic tissue that is holding the scar. Basically, it's the scarring tissue, I would say, that's holding down the skin, like giving this dented
Dimple.
look. Yeah, dimple.
The dimple
yes.
look. You basically put a needle through to cut off the connecting
Yes.
tissue.
Yes. Actually, during this procedure, it looks scary, but it's very comfortable. Your friend is very comfortable. No pain. Yeah, just hearing some gritty voice, and that's all.
But the needle quite long.
Yes.
No. Okay.
But you won't feel the pain.
Okay. I'll talk to him again.
Sure.
So what is this?
So what we do is after the subcisions, we'll do some laser therapy for him as well. Stimulation of collagen formations, and also sometimes resurfacing. It helps to fasten the scarring procedure to be better result, to have better result, I would say.
Fantastic. Okay, this is removal of tattoo.
Yeah.
You do that as
So-
well, huh?
Yes. So basically, a lot of people they won't do tattoos and they regret it. They want to get it done. So we can help as well. Yeah, but it's not as scary as it's thought, because a lot of people say it's much more painful when doing tattoo removal compared with doing tattoo. But you can see my client is very comfortable. She can even talk to me. We are chatting actually. Yeah.
Yeah. I can tell you this because I have a tattoo.
You want to get it
Listen.
done?
No. I don't want to get it done. This is my tattoo is actually the name of my wife and my children.
Okay.
I cannot get it done. How to get it done? No
It's
lah.
good.
Not,
You keep.
it took me 5 years to decide to do this, so I think
I mean,
properly.
not for you, but maybe
Not for
for
me.
other people that regret for their tattoo.
Yes, I have a lot of stupid friends who has tattoo that need to remove.
Sure.
When they are younger, when they're in their 20s, they put their girlfriend name girlfriend's dog name
Exactly.
and all that. They need to do that.
Exactly. So mostly those kind of people that will come to have their tattoo removed.
So once it's healed, right, it's totally okay.
This is just halfway through. You have to go through a few sessions. First of all, the tattoo pigment will get lightened. Yes. Maybe in the end, it will leave on the very weak white underlying marks. Yeah. It depends on cases.
But definitely you won't see anymore.
It depends on cases.
Okay. So what is this? Tell us, what is this? This is a machine that burns fat or what? Burns your double chin or something?
You can see that's me.
Oh,
That is
that
a
is
little
you.
secret
Yeah,
of
yeah,
how
yeah.
I maintain my youthful skin.
I can see that you're enjoying yourself.
Yes, basically this is what we call a HIFU. This is an FDA approved machine. So what they do is we deliver energy hot enough and deep enough into our SMART layer and stimulate our collagen formations on the deeper layer and give us a lifting effect.
Ah, so basically it is a lifting effect lah. Huh?
Yes.
So what is this?
This is what we call the fractional CO2. Yeah, what we do is targeted for those scar patients. So it's good that they go through some resurfacing program. Yeah, so to make the scar lighten up.
Right. So I think we are at the end of the presentation. So a few more questions I'd like to ask you, Doctor. Now,
Sure.
if, I just want to check with you for skin aging. Now, I noticed that the Caucasian ladies are the prettiest when they are on 14 to 16 years old. And after that, they tend to age very, very fast. This doesn't seem to happen to Asian. So Asia only starts to age after the age of 30 normally. Why? Why is that the Caucasians age so early?
So as for Caucasian, they have a lighter skin tone, I would say. So lightly pigmented skin, usually they have a small aggregated melanosome, which will reduce the melanin productions. So decreasing of epidermal melanin compound actually causing the skin develop aging sign much more earlier. Plus also their culture of liking sunbathing, their cultural habit, drinking, smoking, all this actually contributed to speed up the skin aging as well.
So basically it is genetic plus the lifestyle. So Asian
Yes,
ladies
I
don't
would say.
really drink, don't really smoke, quite quiet at home.
Not really. Asian, I would say we have a thicker dermal layer.
Thicker skin.
So
How mean no lah, how fair.
no, we do have a thicker dermal layer compared to lightly pigmented skin people. So when we age, our wrinkles formation might not as be fast as the Caucasians.
Okay, no wonder. So tell us about Botox. Do you do Botox?
I personally don't do, but I perform, yes.
Very good question. So is Botox safe or not, basically?
Okay, botulinum toxin actually is how to say the function is to paralyze the certain muscle, so it don't move anymore. And when you don't have movement, the wrinkles will become nicer and flatter. Okay.
Right.
Yes. So basically, who suitable for doing Botox? Those have wrinkles, or those are not satisfied with their crow's feet, glabellar lines, or sometimes I do have a lot of that refer over for bruxism, which is the teeth clenching. Yeah, those people they will need some Botox to relax the muscle.
Now, I understand from a few colleagues of mine, don't want to mention name, but their face is a bit plasticky. They are 45, 50 years old, or 55. You look at them, you know, this lady went through multiple surgery. But on a certain day, they come in very young one, you know. Then after a few months, you know, the thing come back, you know, the wrinkle. And then after that, you come back, very young already, Suddenly
You sure
young,
it's
like
not your
20
eyesight?
years. Huh?
You sure it's not your eyesight?
Yeah, confirm not my eyesight. Now, my thing is
Okay.
this. We had this thing that we thought her plasticky face it is due to Botox. Is it true?
I did not see your friend, I might not know, but overdoing it might cause a frozen feature, I would say. Yes.
So,
Yeah. So,
if you
so
overdo it,
basically, yeah, if you overdo it.
so what is your
basically,
recommendation? How many times a
usually
year?
we will assess the muscle because everyone has a different muscle activity. So it really depends on your doctors to assess it. If they think it's okay, then they will suggest you to top up. Yeah.
Okay, basically it's to see the doctor, right? And
Yeah.
don't do it yourself at home.
You can't do it at home. You better don't do it at home.
Yeah.
Because injection, yeah.
I have a doctor wife also. I won't ask her to do it at home.
Because injection into the wrong muscle or the spreading of the products over the injection site might give you a bit of unwanted result, I would say, unintended paralyzing of the wrong muscles. So you might ended up in asymmetrical phase, yeah, and all these things.
So how important is actually seeing an aesthetic doctor to get your face done properly is this. My wife is a doctor. She sees Dr. Su Senn also. Let's just put it this way, right? She doesn't administer her own face and she went and see a professional that does it, right? So anyway, my wife is a different type of doctor. She's a pathologist, so
Yes. So basically, it really depends on the doctor's assessment and skills.
Dr. Su Senn, I understand that you have partners in your clinic. You handle aesthetic, and you have Dr. Low who handles dermatology. So dermatology means skin diseases lah. So what is that full-fledged kind of dermatology clinic that is run by Dr. Low? Tell us more about that.
So basically, Dr. Low is our in-house dermatologist. So he will be here seeing a lot of psoriasis cases, eczema cases, and all other skin diseases. And sometimes he'll perform some dermatosurgical cases as well. Like maybe it's a malignancy or what, then he will do a biopsy and send over.
So basically, Dr. Low does a lot of derm work, surgical work, derm work, basically a psoriasis, skin problem, and all that, eczema.
Yes. Because nowadays we have a lot of eczema patients.
Yes.
Either they will come over, I will see, or Dr. Low will see. Yeah, it's due to our hand washing with all the sanitizer, all the chemical triggers.
Yes.
Yeah, we do have a spike of eczema patient come over lately.
So basically, it's a full-fledged clean clinic, aesthetic medicine plus dermatologist, Liv Clinic.
Yes.
So, guys, all the audience out there, if you have a skin problem, if you live around Bukit Jalil or Puchong, or somewhere in between Sedang, Balakong, the whole area, OUG, Happy Garden, if you need to see a good dermatologist and to make yourself pretty, I think you can go and visit Liv Clinic. My personal experience is not that they are paying me to do this show. Nobody pays me to do my show. My personal experience with them, I'm actually quite happy. I think your staff are very well trained. All four of the staffs are very well trained. They take care of us very well. You know, they keep giving us tea, coffee, and biscuit until we say enough. But we are quite happy to receive coffee, tea, and biscuits. But anyway, it was a pleasant experience. So for the last question for the show, Dr. Su Senn, what motivates you and what makes you happy doing aesthetic medicine?
Other than me myself turning more younger skin or more healthy skin, I would say, because I was an eczema patient last time. So other than that, what makes me happy is actually seeing my patients' transformation. Yeah, you can see that transformation from outside in. I cannot do inside out, so I can do outside in. So once they are satisfied with their appearance, they are much more happy. Once you receive a lot of compliments, you feel much more happy. Actually, it changes mentality a lot. So I can see my client actually from a very gloomy look become very happy look. Now she's very excited to see me every month to have a skin, go through a skin maintenance program or some enhancement program. She is excited every time she see me.
I am
Actually,
scheduled.
yeah,
Yeah, she's
that pushed
excited to
me
come and see you.
that's pushed me more to keep on going, I would say.
Fantastic. That is the heart of a doctor who wants to give the best to your patient and make their life better, right? At the end of the day, we, both of us, me and you, do the same thing. We always tell our clients, my clients, well, I'm in insurance. I always tell my clients, if you have a problem, don't worry about money. Let me worry about money. I'll take care of all the money problem for you. You would take the money that we pay, the insurance company, and take care of the patient, right? So we work hand in hand, right?
Yes.
But unfortunately, aesthetic is not claimable under insurance yet. But certain things I think okay lah, like dermatologist is fine. Disease, cuts, I've been doing a lot of abscess work, psoriasis that needs treatments and all that. We've been making a good number of claims for that. That is fine. So I think the insurance industry and the medical industry complement each other very well to give proper treatment and improve people's life, right? So thank you so much for coming to the show, Dr. Su Senn. It is such a privilege, and it's so fun to have you on the show. I think you had fun, right?
Yeah.
So remember, if you need to see Dr. Su Senn, she is in Liv Clinic, Bukit Jalil Pavilion. So basically, you can actually Google Liv Clinic. It is actually down there at the what do you call this, the prompter.
Always to us.
Just type LIV Liv Clinic. Google will bring you there, right?
Yep,
Google
definitely.
will bring you there. So I'm scheduled to do my treatment this Sunday, right?
Okay.
And I'm going to
Yes.
with my wife. So I look forward to an amazing treatment and also a good time having that treatment done with you, right? So
Sure,
thank
sure,
you, Dr.
sure.
Su Senn, for coming on to the show. Thank you so much for coming in. And until next week we're gonna have another amazing guest with us. So until next week, see you guys. See you. Say bye bye.
Okay, bye.
Bye bye.